Hello, everyone. It's now 2 p.m. Eastern. To allow for additional sign-ins past the hour, we'll begin our webinar shortly. Hello, and thank you for joining the solicitation webinar. Today, we are focusing on a new Bureau of Justice Assistance, or BJA, funding opportunity, which is the 2024 Improving Substance Use Disorder Treatment and Recovery Outcomes for Adults in Reentry program. My name is Dustin Bartley, and I'm a project manager with the Behavioral Health Division at the Council of State Governments Justice Center. I will be facilitating today's webinar, which is hosted by the U.S. Department of Justice, Bureau of Justice Assistance, or BJA, and the National Reentry Resource Center. Next slide, please. We are also joined today by Margaret, or Meg Chapman, who's the primary presenter for today's webinar content, along with my colleague Sarah Wurzburg, Deputy Division Director in the Behavioral Health Division at the CSG Justice Center. Meg Chapman is a policy advisor supporting the Corrections, Reentry, and Justice Reform Policy Office of BJA. She has spent the last 25 years working in a variety of social science research, policy development and analysis, and program evaluation roles. Her portfolio of work is focused on the intersection of behavioral health and corrections and includes informing policy related to the identification of individuals with behavioral health disorders at the point of detainment, the assessment and provision of evidence-based treatment to individuals while in custody, and continuation of care upon release. She has her MA in Criminal Justice from the State University of New York at Albany. Next slide, please. And to give a sense of today's webinar, first we'll share a quick overview of the Office of Justice Programs, or OJP, BJA, and the Second Chance Act, followed by a review of the available 2024 Improving Substance Use Disorder Treatment and Recovery Outcomes for Adults in Reentry program funding opportunity, as well as a quick section on additional information and resources. We'll also have time for questions and answers. And if you do have questions during the presentation, please send those in using the Q&A button at the bottom of your screen. We are recording this webinar and we will post it on both the BJA and CSG Justice Center websites within 1 to 2 weeks. If you encounter any technical difficulties during this webinar, please reach out to Zoom for technical support. Next slide, please. And next, I will turn it over to Meg, who will tell us more about OJP, BJA, and the Second Chance Act.
Next slide, please. Hello, everyone. Thank you for joining us. I'm going to start off by orienting you a bit to the Bureau of Justice Assistance, or BJA. So BJA is located within the Office of Justice Programs, or OJP. OJP provides a wide range of services to the criminal justice community in the form of grants, training, technical assistance, and research. Although our focus today is on a BJA solicitation, there are other OJP offices and Department of Justice agencies shown on this slide that offer additional grants and programs to support our shared public safety missions. Next slide. BJA's mission is to provide leadership and services in grant administration and criminal justice policy development to support state, local, and tribal justice strategies to achieve safer communities. And on this slide is our main website. So I just want to flag that on the slide here. Next slide. So BJ does this in a number of ways. We do this through funding, which is what we're talking about today, as well as through training and educational opportunities, the development and dissemination of tools and products to support the delivery of what works, and by supporting partnership and collaboration through opportunities to bring the field together through convenings and peer-to-peer networking. So multiple strategies we use in addition to funding to help support the field at large. Next slide. The Improving Substance Use Disorder Treatment and Recovery Outcomes for Adults in Reentry, long title, but that's the solicitation we're talking about today, that's presented in this webinar, is funded through the Second Chance Act. And the Second Chance Act was signed into law in 2008. In 2018, the Second Chance Act was reauthorized to build on and strengthen the original landmark legislation that was passed. The SCA legislation provides funding to reduce recidivism and improve outcomes for youth and adults leaving detention and incarceration. So it's really focused at that point of reentry, and in this case, with supports prior to reentry and supports continuing as folks are released. Funding has supported over $500 million in reentry investments across the country, and these grants are administered by both BJA and OJJDP. OJJDP focuses on those for juvenile populations and BJA primarily for adult populations, which is the case with this solicitation as well. Next slide. The Improving Substance Use Disorder Treatment and Recovery Outcomes for Adults in Reentry solicitation is one of 8 solicitations that will be released as part of the suite of Second Chance Act grant programs supported by BJA. While we're focusing on only one of these grant programs today, we encourage you to visit BJA's website over the coming months to learn more about the others, that some of which have already been released or on their way to being released. And the link for that page, which is just our funding opportunities page within the, that is an offshoot of the main BJA page, is listed here as well. Next slide. The structure of the SCA program is to provide funding to agencies and organizations to support the implementation, piloting, and/or expansion or enhancement of reentry programs through competitive grant programs. We complement our SCA awards with training and technical assistance that is available through a provider who, in this case, has expertise in both substance use disorder treatment and as well as reentry programming and in federal grant administration. So if you were to be successful, this is all to say that if you were to be successful in your application, you would have the support of a training and technical assistance provider to support you in the implementation of the grant. Next slide. And I guess this is going on to say that the grantee teams, those who receive awards, will be supported throughout the active grant cycle by representatives from BJA's policy office, which is me, and our programs office, who focuses really on supporting that day-to-day administration of the grant, as well as by a coach from, in this case, is the Council of State Governments Justice Center, who serves as the training and technical assistance provider for this grant. I'm going to turn it over to Sarah, who is from the Council of State Governments Justice Center, to share a bit more about her organization and other SCA supports that are available to both grantees and non-grantees. Sarah?
Thanks, Meg. So the Council of State Governments Justice Center also operates the National Reentry Resource Center, which is a collaborative project between BJA and the Office of Juvenile Justice Delinquency and Prevention. The NRC's job is really to disseminate knowledge to people working in reentry and reentry partners from the justice, the health side, and others, and to serve as a convener and coordinator of grantees. And then the Council of State Governments, we're a national nonpartisan nonprofit organization dedicated to all 3 branches of government. And within the Justice Center, we are the criminal justice research and policy shop for the Council of State Governments, or the CSG Justice Center. And we're lucky to be the training and technical assistance provider for all the health and housing grantees, with which this grant focuses on as well. And we're able to provide support through access to subject matter experts, both from our organization, but also current past grantees, other experts in the field, subawardees that we work with on specific content expertise, the peer connections. We also focus on development of resources that directly relate to the issues that grantees are facing. So that's some of the support that we can provide, in addition to supporting the planning and implementation guide processes, which Meg will get into a little bit later. And I'll pass it back to Meg.
Great. So we're going to take a pause here and shift into a polling question so that we can get a better sense of your experience with federal grants. So if you can respond accordingly, if you can pick the choice that best fits you, and to reflect on whether your organization has extensive experience with federal grants, does not currently have any federal grants, has limited experience with federal grants, or is new to federal grants and looking to learn more. We'll give a few minutes. Once we close the poll, I don't know if we've done that yet, we'll get to see the results. Okay. So kind of a mix here of kind of almost a 50-50 with those with some experience and those without. So that's really helpful to me, because I'll make sure that we cover some of the, just be more specific in some of my guidance for you on a solicitation. Okay, thank you for that. And next slide. So now I'm just going to walk through the solicitation a bit, starting with some of the basics. So through this solicitation, BJA anticipates making up to 6 awards for a maximum dollar amount of $833,000. And those awards will be for 3 years or 36 months, starting October 1st, 2024. Next slide, please. And there are 2 funding categories, which basically just means we review applications within those funding categories. So we have one category, which is for applicants from state, local, and tribal governments. And category 2 is for nonprofit organizations. So those funding decisions are made within each of those categories. And as I will get into later, it will be informed by an external peer review process. Next slide. So through this program, BJA seeks to support state, local, and tribal governments, as well as community-based nonprofit organizations, hence going back to those 2 funding categories, to establish, expand, or improve treatment and recovery support services for people with substance use disorders during their incarceration and upon reentry into the community. So applicants are invited to propose evidence-based, culturally relevant programs to address the substance use disorder treatment and recovery support needs of people, including parents of minor children and pregnant postpartum women during their incarceration and reentry. So while we have 2 funding categories, as we'll get into over the course of this webinar, it's really what we really do anticipate, that whether the state, local, or tribal government agency is the lead or the community-based nonprofit is the lead applicant, that there is an expectation that you'll be working together in partnership. Again, we'll get into those, how you demonstrate that in a moment. Next slide. Programs funded under this solicitation should be working to ensure and use funding to ensure that individuals are screened, assessed and identified for treatment for substance use disorders or co-occurring substance use and mental health disorders upon entry into a correctional facility. And then while incarcerated, people should have access to treatment, including family-based programming and reentry planning. And then following release from incarceration, participants should continue to receive treatment and wraparound services based on the results of their screening and assessment that support continuity of care and long-term recovery in the community. So that's the overarching goal and objectives of this program. Next slide. BJA encourages applicants to request funding to support a comprehensive, going back to that comprehensive program to support people with substance use disorders during their incarceration and continuing that support upon reentry into the community. Elements of a comprehensive approach include using a validated screening tool to screen all individuals entering a correction setting for substance use and risk of substance withdrawal, using a validated tool to assess all those that screen positive for substance use to diagnose substance use disorders and any co-occurring mental health disorder, implementing policies and procedures to support medically managed withdrawal, consistent with the solicitation makes reference to guidelines for managing substance withdrawal in jails. Developing collaborative comprehensive case plans that incorporate the assessment results along with the results of a criminogenic risk and needs assessment. Another component is providing evidence-based SUD treatment, substance use disorder treatment and recovery programming pre-release. And evidence-based programs that provide trauma-informed and culturally relevant treatment and behavioral interventions include, for example, medication-assisted treatment, motivational interviewing, contingency management, cognitive behavioral therapy, all those evidence-based treatment modalities. And pre-release programming can include Medicaid enrollment or re-enrollment, connecting and scheduling appointments to continue medication and treatment, and finding placement in recovery or transitional housing prior to release. For prisons, providing family-based SUD programming for parents of minor children and pregnant postpartum women is a component of those prison-based program that could be allowable. Also allowable is establishing relevant and lawful information sharing procedures to support continuity of care from incarceration to reentry, and continuing the provision of case management and treatment services post-release, as well as providing those recovery support services post-release. Some of those post-release recovery support services can include, for example, access to health and behavioral health care benefits, peer support services, medical services, counseling services, recovery or emergency housing, transportation services, employment services, and education services. So as reflected here is the, how you can use the grant covers the whole spectrum of support that someone might with a substance use disorder or co-occurring disorder might need within the facility and as they re-enter back into the community. Next slide. And I just want to flag for those proposing a prison-based family treatment program intended for incarcerated parents or pregnant postpartum women in a correctional facility. There are 3 components that must be included, and that those 3 are integrating techniques to assess the strengths and needs of the incarcerated parents and their extended family to support a treatment plan for the incarcerated parent, ensuring that each participant has access to consistent and uninterrupted care if transferred to a different correctional facility within the state or another relevant entity, and to locate services in an area separate from the general population of the prison for those participants in the program. Next slide. So there are 3 program priorities for applications that 1, propose projects that are designed to meaningfully advance equity and remove barriers to accessing services and opportunities for communities that have been historically underserved, marginalized, adversely affected by inequality, and or disproportionately impacted by crime, violence, and victimization. Another program priority is to those applicants that demonstrate that their capabilities and competencies for implementing their proposed project are enhanced because they, or at least a proposed subrecipient that will receive at least 40% of the requested funding, are a population-specific organization that serves communities that have been historically underserved, marginalized, or adversely affected by inequality. And so then there's a third priority consideration to programs that propose to implement or expand access to medications for substance use disorders, counseling and behavioral therapies, sometimes called MAT in the corrections setting, for those with opioid use disorder. And that third priority related to MAT programs is in response to the opioid crisis and overdose epidemic continuing to devastate individuals, families, and communities across the nation. Addressing these issues is a federal priority, including increasing access to evidence-based treatment, such as medications for opioids or opioid use disorder, counseling, and behavioral therapies across all settings. Incarceration offers an opportunity to screen and continue or initiate treatment for individuals with opioid use disorder while incarcerated, and to support continuity of care after release into the community. So this is why this is a third priority for this application for those in the facility with opioid use disorders. So as we'll get into when we go through the program narrative, there's opportunity to note to reviewers that you're intending to seek priority consideration. But I also want to note that addressing these priority areas is one of many factors that OJP considers in making funding decisions. Therefore, receiving priority consideration for one or more priorities area does not necessarily guarantee an award, but it is considered in the review process. Next slide, please. So sometimes it's just helpful to have some examples, and these are examples of potential ways to use grant funds. One is like a partnership between a state or local corrections agency and a nonprofit treatment provider to provide pre and post-release substance use disorder treatment. So that means providing in-reach services. That sort of treatment provider would start providing treatment services while someone's incarcerated and continue into community. Another example might be a partnership between a community supervision, corrections agency, and nonprofit treatment provider to enhance gender responsive treatment and reentry supports for women with substance use disorders who are on community supervision. Another partnership might look like a partnership between pretrial services and a nonprofit treatment provider, supporting identification and connections to care for people with substance use disorder who are in pretrial status. The bottom line is that you should propose a program that will help you provide comprehensive programming for people in the correctional facilities in your community with substance use disorders. Okay, next slide. So next I'm going to review some of the application requirements, and we have some folks on the phone who are newer to this, so I will try to be as specific as possible. The first, next slide, sorry. The first important thing to note is eligibility. Please be sure to review the solicitation on eligible entities who can apply for funding under this program. And that includes state, city, or township or county governments, Native American tribal organizations, and nonprofits having a 501c3 status with the IRS or not, other than institutions of higher education. Please be sure to review the solicitation. And if you have any questions about eligibility, do reach out to the OJP Response Center. The phone number and email for that response center is in the solicitation, because it's an important factor before you start working on your application. Next slide. This slide identifies, it's the first of two slides actually, that identify application elements that must be included in the application to meet the basic minimum requirements to advance to peer review and receive consideration for funding. So the first is there's two forms. One is the application for federal assistance, or SF-424. and the disclosure of lobbying activities, or SFLLL, that need to be submitted through grants.gov. And we'll get into a little bit of the grants.gov versus just grants, but I'm just sort of noting these words because they will become important later. The second thing is the proposal abstract, which will be submitted in Just Grants. The proposal narrative, which will be submitted in Just Grants. Application goals, objectives, and timeline, which will also be submitted in Just Grants. And the budget web-based form, which includes the budget details and the budget narrative, which will also be submitted in Just Grants. Next slide. Continuing in terms of components that should be included in your application to move forward is, and with the exception that this is for nonprofit applicants only. As I mentioned earlier, we really want to see that partnership. And so for those community-based nonprofit applicants, you all should include for each corrections agency partner a signed memorandum of understanding that clearly demonstrates an established collaborative relationship between the applicant and the correctional agency that oversee the facility or facilities from which the applicant proposes to recruit the target reentering population and or the community corrections agency for the target population. And so this solicitation identifies what information should be included in that memorandum of agreement or a memorandum of understanding, which is essentially the roles and responsibilities of the staff from both of the agencies to support each other in the partnership and the terms of access to the correctional facility or facilities, and the data elements that will be shared as part of the performance measures that partnering agencies will be responsible for submitting. So these MOUs will be submitted as a separate attachment to the application. Now I'm going to just cover briefly, because we'll cover it again later, because they're that important, is two other mandatory components, which is assigned mandatory treatment service provider certification. Sorry, I'm stumbling over my words. So this is a certification that's signed by the appropriate authorized representative for the applicant that essentially certifies that all collaborating service provider organizations listed in the application meet applicable licensing, accreditation, and certification requirements. So this is just our opportunity to confirm that the treatment providers that are going to be participating in the program have the appropriate licensing, accreditation, and certification and have met those. And then another final requirement is assigned mandatory chief executive assurance to collect and report on recidivism indicator data. We will come back to this in a few slides, but this is assigned assurance confirming that applicants acknowledge and plan to meet. There's a requirement to track and report on recidivism for at least 12 months following the release of participants from incarceration. So that just needs to be signed by the chief executive of the relevant criminal justice agency. So again, these two slides cover all of the components that are required for all applications. Applicants, with the exception of the correctional partner agreement, is only for nonprofit applicants, but that are essential to and required for moving forward. Next slide. So I'm going to just go through just the basics of the proposal abstract and the proposal narrative. Again, those are required pieces, both of which will be submitted through Just Grants. The proposal abstract, just flagging for you that should be no more than 400 words summarizing the proposed project, including its purpose, primary activities, expected outcomes, service area, intended beneficiaries, and subrecipients if known. So that's completed in Just Grants in a web-based form. So just follow the guidance in the solicitation on the requested content, because there is more detail than I just shared in terms of what we are hoping to see in that abstract, including whether you're seeking priority consideration. Other note is that the abstract should be in paragraph form without bullets or tables and written in the third person and exclude personally identified information. And that is because those abstracts will be made publicly available. So that's why there's some limiters on what should be included in those abstracts. Next slide, please. Okay, now we're just going to talk a little bit about that proposal narrative. And that this will be submitted as an attachment in JustGrants, and that attachment should be double spaced using a standard 12-point font size and have no less than 1-inch margins and should not exceed 20 numbered pages. So that hopefully those pieces, which is also listed in the solicitation, give you a sense of the guardrails on developing your proposal narrative. And then in the solicitation, we go through each of the sections that should be included in that proposal narrative and some guidance on drafting each of those sections. I'll go through them at sort of a higher level right now. The first being the description of the issue. And that's your opportunity to describe why the project proposed activities are necessary to address a need and include that supporting information, such as data to provide evidence that the need exists, or demonstrating the size and scope of the problem, or document the effects of the problem on the target population in the larger community. So this includes describing the current process for screening and assessing individuals for substance use disorders as they come into the facility, the current availability of substance use disorder treatment and recovery support services pre-release, current practices for connecting people to care upon release, and any gaps in the above process. And then you move into the project design and implementation, and that's where you describe the strategy you propose to address the problems or needs identified in that previous section or description of the issue. So the goal here is for the description of the issue to sort of highlight for the reviewer what the issues are and what the gaps are, and the project design and implementation to identify how you are hoping to use the grant, including listing the activities and to describe how they relate to the goals, objectives, deliverables, and timeline outlined in a web-based form that's completed separately from the narrative. And for nonprofit applications, it's just also not nonprofit applicants. This is also an opportunity to just acknowledge that the requirement for an MOU and MOA is part of the submission. It's also an opportunity, again, to elaborate a bit more on how you anticipate if you're seeking consideration under the priority areas, how you hope to meet those priorities as part of your proposed application or program. Next slide. Then there's 3 more sections to the proposal narrative. One is capabilities and competencies, and that's your opportunity to describe the capabilities and competencies required to accomplish the goals and objectives of the project, including your description of your organization, the competencies of the individuals participating in the program, especially those who provide the substance use treatment services. Again, going back to that Appendix A. Those should, marry up. The qualifications, if you have an evaluation partner, of that evaluation partner, and if you are a nonprofit organization, the history of collaborating with the correctional partner that you've identified in your application. The other is plan for collecting the data required for the solicitation's performance measures. As I mentioned, that would include describing the process to accurately report 12-month recidivism data for per year certification as part of Appendix B for those participating in the program. And then, as I've already mentioned, there is a application, the goals, objectives, deliverables, and timeline is a web-based form that is also submitted as part of your application. Next slide. So I've mentioned these a couple of times, mostly because they're important, and secondly, because they are an appendix to the solicitation and just don't want them to be overlooked. This is is a thumbprint of what that Appendix A looks like. And again, this is just the certification that's signed by the authorized rep to certify that your treatment providers have the applicable licensing, accreditation, and certification requirements. You can't read this, but it also notes what kind of materials we're looking for to demonstrate this in terms of a letter of commitment and documentation that should be included, and that the that we're looking for documentation, not a statement or a letter from the organization or from a provider organization saying that they are compliant with licensing, accreditation, and certification is not sufficient. We're really looking for the documentation, and so that certification lists the types of documents we will accept. Next slide. This is a thumbprint of the Appendix B, and again, this is signed assurance that just confirms that the applicant acknowledges and is planning to meet the requirement to track and report on recidivism data. So this is what it looks like in the solicitation, Appendix B. Next slide. So if awarded, grantees are expected to deliver an action plan consisting of a problem analysis summary, a summary of the strategies and intended outcomes, and if appropriate, an evaluation plan, or at least a plan to track and report on the recidivism data. And so this is an action plan. I think Sarah mentioned, we sometimes call it a planning and implementation guide, but the reason that this is a sort of benchmark for us is that we work with our training and technical assistance provider, in this case, Council of State Governments, to work closely. Those coaches will work closely with each of our grantees to complete this planning and implementation guide. And this is really an opportunity to sort of lay out a foundation for how the grant will be implemented. And it's something that we at BJA then review and approve, and that allows for all of the funds to the grantee to be released to support implementation. So it's just, as I said, it's kind of a milestone mark between planning and implementation, and allows us to kind of control the funds until you're ready to support full implementation. And then at the end of the grant is a final report. If you have a research partner written with that research partner, that documents the program, its outcomes, and any lessons learned. So the program objectives and deliverables, including the action plan and the final performance measures, as I've mentioned, the recidivism data, and the final report should be included in that timeline that is part of the application. Next slide. Again, so the applicant, which again can be either a state, local, or tribal government agency, or a community-based nonprofit organization working with a corrections agency, may seek funds in a number of areas. And these are just some examples to hire personnel. That could be case managers, reentry coordinators, behavioral health providers, peer support specialists, pay for medication. That can be psychiatric medication, as well as the FDA approved medication for opioid use disorder that was mentioned, or naloxone. Pay for screening and assessment tools and associated training, provide transitional or recovery housing, contract with another organization for peer support or treatment services, like we mentioned some of those partnerships earlier, or contract with an organization to provide recovery support services in the community, training, evaluation services if you're looking to work with a local evaluator. There is, these are just some examples, and there's also a link to OJP funding guide for any other questions about what's allowable and what's not allowable. Next. So as I mentioned, there's elements of the application that need to be submitted to move forward. Once an application moves forward, it's evaluated by peer reviewers on how the proposed project addresses 5 different criterias. One is the description of the issue, and that's just the applicant's understanding of the program issue to be addressed. The design and implementation is where peer reviewers evaluate the strength of the proposal, including information provided in the goals, objectives, timeline, and deliverables web-based form. So both that section of the narrative as well as this web-based form are relevant in that review. Capabilities and competencies. Again, that's where the peer reviewer evaluates applicants' administrative and technical capacity to successfully accomplish the grant. And then plan for collecting data required for the solicitation's performance measures. Again, that goes back to the program narrative where you're describing how you're be able to collect and report on those performance measures. And the budget then is evaluated for completeness, cost effectiveness, and the extent to which it's the items are allowable. Next slide. So I know the solicitations are long and detailed, but I encourage you to review them closely and note the references and links to get support to learn more about certain things that are certain elements of a comprehensive treatment program that are noted. And I'm going to go through some of those links now, but as I said, these solicitations are peppered with links as a means to help you and unpack some terms that you may not be familiar with. Next slide. So the solicitation incorporates guidance provided in the OJP grant application resource guide, which again, there's a link to that in the solicitation. And that provides additional information for applicants to prepare and submit applications to OJP for funding. So as this slide, even though it's very small, but suggests that the content of the resources that are available is quite, there's quite a lot here. And so hoping that if you go here and if you have questions, that's where you can get some answers. And as I mentioned earlier, if you still need assistance, that's where you would reach out to the OJP Response Center. There's a phone number and email in the solicitation, email being grants@ncjrs.gov. Next slide. I've mentioned Just Grants, and that is one of the two systems that will be used to submit an application. And this site, as reflected on the slide, offers tools to support use of Just Grants. To not only submit your application, but then if you are to be awarded, that's the system that you'll be relying on to support an implementation of your grant. Next slide. So there are two systems that I've mentioned a few times, and I just want to pause here for a second and talk about the two of them. One is grants.gov, and if you looked at the solicitation already, you'll see there's a deadline of May 6th of this year for you to submit application for federal assistance, which is the SF424, and the disclosure of lobbying activities, which is the SFLLL. Per the solicitation, we really encourage you to start this process as early as possible, at a minimum 48 hours before the due date of May 6th. So that is where just those two forms are submitted, and that opens up the window to submit your full application in Just Grants. And that's where you submit the rest of your application. And that is a different deadline of May 13th. So it is two different deadlines. You need to do the work to submit those two forms by May 6th. And then you have time, a little bit of time to get the rest of, and that is your program narrative, abstract, budget, all the other elements we talked about on May 13th via Just Grants. So this slide has information on if you need assistance with either of these systems, how to get customer support, phone or email. And I think the message here is to start the process early. If you need assistance, reach out. And in the solicitation, there's specific instructions on how to handle if you have technical issues, how to handle any technical difficulties with either system, to just sort of document and track that for your records. Next slide. This is just a plug to subscribe to OJP to get announcements so you can stay up to date on all of our activities. OJP. Next slide. And this slide includes links to social media platforms so that you can stay connected to BJA and learn all about our happenings. As I mentioned, we don't push out just funding. We also push out a lot of training and technical assistance resources to the field. So do encourage you to subscribe. As I've already mentioned, and here is that phone number and email, is if you have questions as you're going through this, to please contact the OJP Response Center with those questions and so that you can get a timely response. Next slide. And again, this is just, please remember the dual deadlines of the application. The first deadline of May 6th for the application for federal assistance and disclosure of lobbying activities, and then the rest of the application requirements on May 13th. And please note that that's at 8:59 p.m. Eastern time that those are due. Next slide. And I'm just going to close with some quick reference. Again, a little repetitive, but it's okay. Repetition is good because if you need help, we want to make sure that you know how to receive help. All of this is also in the solicitation, but so just it's here. But it's also in the solicitation. Next slide. Okay, so I think we're going to open it up to questions. I know that my partners here at Council of State Governments have been monitoring and I think trying to answer questions as they come up. But if they're going to raise for me any questions that are, you know, appropriate for the group. In some cases, they may have directed you to the OJP Response Center. If for sort of narrower questions, that's generally the better place to go. So I think I'm going to pass it back to Sarah, perhaps.
Meg, we've been gathering a few questions for you that I think would be helpful just to answer or to reiterate for everyone. And the first one is, are nonprofits able to apply for this grant?
Yes. Yes, they are, as I mentioned, they are one of the categories. There's two categories of eligible applications, one being state, local, and tribal governments, the other being nonprofit organizations. And if you are applying under that category, just noting that there is that specific requirement to submit a signed memorandum of understanding with the correctional agencies that you hope to partner with as part of the application and eventual program.
Thank you. And another question, can I provide post-release services in the community as part of this grant?
Yes, so going back to some of what I covered earlier is that we're really looking to support a comprehensive response to individuals coming into your facility with substance use disorders or co-occurring substance use or mental health disorders. So that really starts at intake and incorporates that screening and assessment, case planning to provide treatment services and reentry planning through case management while someone is still incarcerated, and then really to facilitate that reentry process to ensure continuity of care and access to recovery support services in the community.
And following along with that, would it work if people were on community supervision for this grant?
Yes, so I would definitely look at the solicitation, but if you looked at the solicitation, you would see that community supervision organizations are a potential correctional agency that can be partnered with as part of this grant, or in combination, if you're not a nonprofit or organization, the corrections agency, community supervision agency community-based service providers are all stakeholders in supporting a positive reentry experience and minimizing that risk for relapse and return to and recidivism.
Thank you. Are higher education institutions eligible applicants?
I would encourage everyone to look at the eligibility requirements, but as I noted in the one of these slides, nonprofits are eligible, but other than institutions of higher education. And if folks have like more detailed questions about whether they are eligible, that's where more of those, there may be some unique situations that I would encourage you to reach out to the OGP Response Center.
Thank you. Can you describe a bit more about who constitutes a peer reviewer?
A peer reviewer is someone who is not an internal reviewer, it's an external reviewer. And that is someone from the field who applies to be a peer reviewer for OJP and then is willing to review applications based on guidance from OJP. So it's specific to the nature of the solicitation in terms of the backgrounds of the individuals, but it's aligned.
Thank you. Do you have to be a treatment provider to be eligible?
Again, eligibility can include both state, city, county, local government entities, as well as a nonprofit community-based service provider. So it can be either or. Just working in partnership with each other.
Thank you. And then, Sarah, did you see some additional questions that you were hoping to have Meg address for the entire group?
Yeah, so Meg, we're getting a couple of questions on the two application dates, one for grants.gov and one for Just Grants. Can you just give a brief explanation of what that difference is?
Okay, yes, certainly. So the first date is May 6th, and that is the date those two federal forms need to be submitted into grants.gov. The one form is application for federal assistance. That's a standard form, SF424. And the other is a disclosure of lobbying activities, SFLLL. And so those two are sort of the gateway into the rest of the application in Just Grants. In Just Grants, I don't know, well, going back to slides, probably a little, but we talked about the components of so on slide 25, we talked about the components of a successful application. So I don't know if you want to go back to slide 25. Because there was less, you didn't have all the context when we went through this. So this first application for federal assistance, SF424 and SFLLL, which is the disclosure of lobbying activities, are the two forms that need to be submitted into grants.gov by May 6th. Then the rest of these items on this slide, and then on the next slide, which were those signed certifications and the memorandum of understanding for nonprofit applications, all get submitted through Just Grants, and those all need to be submitted by May 13th. So it's a two-stage process. The first being that submission of those two forms into grants.gov. And again, those are forms, so they're not looking for your application to be fully built out. You have more time for that. But as I mentioned, especially in grants.gov, we encourage you to take those steps at least 48 hours before May 6th, so that you can just ensure you don't run into any issues and you can move forward to submit the rest of your application in Just Grants within the time window. Hopefully that was helpful.
We also got a couple of different questions from people if they already have a Department of Justice BJA award for a different grant program. Are they eligible to apply for this?
Yes, you are eligible. We, as even within the Second Chance Act suite of programs, there are different focuses of different solicitations and funding opportunities through BJA, and it's very expansive. So we, so having more than one BJA grant is possible. What we, and I think it's even part of the application process, is identify if if there's a possibility that you have another grant that's that you might be building, expanding that program through this application, to sort of note that. But in general, there is having a BJA grant does not preclude you from applying for another one. As you know, as you may or may not know, but within all of our grant programs, you know, we look for the grant program to act as sort of seed money to build out a program. So looking for you to think about how to sustain that program from the beginning of the grant program. So that's all to say that requesting one BJA grant to continue a program that you've supported through another BJA grant is not what we're looking for. We're looking for you to really build out new programs to support your community through our grant programs.
Thank you. There was also a couple of questions about the required recidivism indicator performance data. And is that a requirement for all applicants, regardless of if you're a nonprofit, a correctional institution?
That's a great question. And yes, it's applicable for all applicants as part of performance measures that we require under this grant program. So all applicants would be expected to track recidivism for program participants for 12 months post release from the program.
The one thing I would add to that is if you're a nonprofit agency and you don't have access to that data, you may partner with a correctional agency to get that data. So I think the important thing to remember is whoever is in your program team would have the ability to get some of this information, even if your agency might not typically have it.
Great point. Thank you, Sarah.
There are several questions about what this award can fund. So just reminding everyone that I put the Department of Justice financial guide in the chat, and that's really a good resource to go back to. And if you have questions about really specific things which could or could not be funded, it's great to check there when you're putting in the application.
Yeah, and when it's reviewed, it's really looking for that nexus between what you plan to do and how and whether the funding request aligns with your proposal, as mentioned as part of the peer review criteria.
So there's a couple of questions on the amount of the award, and just so do you have to apply for the exact amount of $833,000, and is it over a 3-year period?
Yes, it is a 3-year award, and it is a couple of things. One is, as I mentioned, there is an action plan or program and implementation guide where grantees will have access to $100,000 of their award to complete that step or hit that milestone, and then the rest of their award will be available to them. But going back to this question, while the maximum allowable funding amount is $833,000, we really encourage you to think about your needs and the program you're proposing and what makes sense for that program. So again, that's the maximum amount of award. If If it doesn't make sense for your community to apply for something less than that, you know, to hit that maximum amount, you can feel free to apply for less than 833,000. You just can't apply for more. And depending on the size and scope of applications received, we may be able to make more than 6 awards, but these 6 awards at 833,000 are the sort of that max amount. And that's where 6 awards would come in. So bottom line is think about what your community's needs are and build out a program and a budget that makes sense to you, and just don't go over that amount.
All right. Well, thank you, everyone, for your participation in all the questions today. And as a reminder, excuse me, the OJP Response Center is your resource for additional questions and those specific questions related to what it is that you might be proposing. But as we wrap up the webinar today, I'd like to say a special thank you to Meg Chapman for her presentation, and we encourage you all to consider applying for this funding opportunity from BJA for the 2024 Improving Substance Use Disorder Treatment and Recovery Outcomes for Adults in Reentry program. Thank you, everyone, and have a great afternoon.
Second, please apply. Take care, everyone. Thank you.